Good morning, everybody. This is Phil Pugh. I have 10 o'clock. We're going to go ahead and get started with our quarterly coalition meeting. I know folks will continue to join. We have about 24 folks on. We'll continue to join. As a reminder, please keep your phone muted if you're not speaking to ensure folks are able to talk clearly throughout the presentation. Please remember, again, don't put your phone on hold if you are actually dialing in and not on the actual Teams meeting. This meeting is being recorded and this afternoon will be uploaded to our YouTube channel. So if you have any issues with being recorded, please drop off now and you can watch it later. Outside of that, we're going to go ahead and get started. We'll do a quick roll call. So we'll start out with our hospitals. Anderson Hospital.
I'm here, Phil. This is Eric.
Good morning, Eric. Alton Memorial.
Morning, Phil. It's Ashley.
Gotcha, Ashley. Boyd. Okay, I don't see Nancy on. Okay, Carlinville Area Hospital. How about Staunton? Fayette County. Gateway Regional. I see Tina's on, so I'm gonna say we got you. Got you, Tina.
I'm trying to unmute.
You're okay. You're unmuted. I hear you. you're unmuted. Gotcha. Gateway Regional. HSHS Holy Family. St. Elizabeth's.
Brad Perry's attending.
Gotcha, Brad. St. Joseph's Breeze.
I'm going to announce for them, unless she's on. Renee, are you on?
Renee is not on, Brad. I am on. Mandy Ennan for Breeze and Highland, just FYI.
Okay.
Okay, great.
Tim wanted me to make sure that we announced that Renee is leaving her position at Breeze, and then we are hiring a person starting March 15th at HSHS St. Joseph's Highland. So that person will be announced at our next meeting.
Okay, very good. Thank you, Brad. Jersey.
I'm on here.
Gotcha, Kelly. From here at Belleville, you got myself, and I believe Lee's probably jumped on by now. He's just come back over from our vaccine clinic, so great. And I know we probably got Mike on, where a lot of folks are attending meetings this morning. Mike Gilbert probably is on, and for Shiloh, Eric Perham should be on. He's here in the office today, so we're covered there. Chester.
Georgia's here.
Thank you, Georgia. OSF St. Anthony's. Redbud Regional. I saw Dan. Oh, I'm
Tara
sorry.
and Diane are here.
I see Diane. Yep, gotcha. Tara and Diane. And I'm sitting there jumping the gun. Sparta.
Dan's here.
Gotcha, Dan.
Dale's here too.
I'm sorry. Who was that last person? Okay,
Dale.
Dale.
Sparta's here too.
Thank you. Touche. I don't see Eric on. Okay. Or Amy. Okay. Health departments. Bond County.
Yeah, Terry, I'm here.
Gotcha, Terry. Calhoun. Clinton. Anyone from Eastside Health? Fayette. A little light on health departments today. Greene County. Jersey. Madison County. Monroe County. Randolph County. And St. Clair. Oh, I'm sorry. Who was that? Last person from, was it Randolph?
Derek's here from Macoupin.
Okay, gotcha. Derek and someone behind there. I heard.
Angie from Randolph.
Gotcha, Angie. Thank you so much. And I don't know if do we have Sam or Milo on from St. Clair County? Okay, our community partners and our IDPH team, RMSC, Greg.
I am on. Phil.
Yes, sir. Got our emergency response coordinator, Beth Busman. Are you on? Nope. Okay. Any of our BJC partners? We're up to 29 on the call. Any emergency management agencies? EMS agencies, we'll start with MedStar Ambulance.
Good morning. You got John Nowak.
Gotcha. John, how about our Abbott?
Chuck's hiding out here too.
Oh, I got you, Chuck. I see you. Thank you so much. How about our Abbott team?
Leslie Schmidt's on the call.
Gotcha, Leslie. Any other EMS agencies? Okay, how about SLU?
Jim Lambrecht's here from Columbia. Yes.
Oh, I'm sorry. Who was that? Was that Columbia?
Yes.
And who was that? I'm sorry.
Kim Lambrecht.
Oh, hey, Kim. Thank you. Helen, I see you on from SLU.
Good morning,
Thank you.
Phil. How are
Good
you?
morning. Any of our Scott Air Force Base family? If Tim's able to make it this morning. And stars. I see Dale's on. Dale, you there?
Yes, sir.
Okay. Thank you so much. Anyone else that I did not call? Here's your opportunity.
Hey, Phil, it's Stacy with Chestnut Health Systems.
Thank you, Stacy.
Ashley Hilsman with Residential Hospice.
Thank you so much. All right. We'll continue on. So welcome again. This is Phil Pugh, your regional hospital coordinator and chair of the Hope Coalition here in the Edwardsville region. I'm hoping everybody's doing well. Welcome to our quarterly meeting. This one, not a ton on the schedule today, but we'll knock some things out. We'll go through our COVID update and we'll go through our general agenda for our quarterly meetings, and then we'll open it up to the floor. Just as a start off on looking at our regional curve. So for those of you who can see the slides and received a copy of the slides via email, I mean, this looks great. I can't say anything, but it looks great. Just as a reminder, the blue line is actually the COVID census, and the red line above that is the impact total. Basically means the number of deaths and folks that are on ventilators. And as you can see, if you kind of look back to the June timeframe where we had a very small gap between that red and blue line, and when we were at our lowest point in June, we're starting to get back to those levels where that gap is a lot closer together. And I believe that as of this or yesterday, I didn't calculate this morning's, but we were at 85 total COVID positives and PUIs in our inpatient setting across the region. So, I mean, that's great. That's a low. I mean, that's a very low number from 2 months ago. So, it's a reflection of all the work that you guys are putting in, and we'll talk about that here in a second. So love seeing that curve go down. Some of the Region 4 data, as you can see, everybody, we don't have any folks outside of the phase 4, any of the mitigation phases across our regions. Our current rolling 7-day average for positivity is only 3.8%. If you get down to our ICU bed availability, I think we're at 31% today. And we continue to see those inpatient days decreasing. So 8 out of the past 10 days have been in the downward direction. So great information. I did add the vaccine slide on our last monthly meeting, or vaccine data on our last monthly meeting. And this is where we're at. This is where we're standing as of this morning with regard to vaccine data across each one of the counties. So great work for everyone out there. As you can kind of see, we've got at least 172,000 folks that have received a vaccine, at least one shot here in our region. And we got a little over 45,000 folks that are fully vaccinated, leaving us at about 8% fully vaccinated state. So really great work out there that's going along. And hopefully we get an opportunity to talk about that and what folks are doing out there in the community today and where we can help out in those regards. So in Jersey, look at you guys go leading the pack there at 14% fully vaccinated. So great work out to you guys out there. And we got Macoupin County, Greene County, not too far behind. I know some our larger counties like St. Clair County and Madison County have done a lot of vaccinating. They're the most vaccinated numbers, but still around 5%. Of that population, between 4 and 5% of those population groups. So still getting there. A lot of work being done in the community, and we can continue to move forward. So I did want to pause here to kind of open it up just for a little bit of discussion with regard to vaccinations and what's going on across the region, so everybody can have a little bit of situational awareness of where we're at today. And I'll start. So we are running a clinic here, and we talked about this a little bit at our last monthly meeting, or excuse me, our hospital check-in meeting last week. But we're running a clinic here. We've been running one since January, I believe, the 28th. And we relocated the clinic from one of our smaller medical office suites here in Medical Office Building 1 over to our neuroscience building here on the campus in Belleville to the 3rd floor there. And we're running about 500 a day. Yesterday we did 557. That's a record for us. We're just over, I think, 11,000 vaccines just through Memorial Hospital and the clinic that we're running there. And that clinic is staffed with active nurses, retired nurses, paramedics, EMTs, general folks like myself, walking around doing logistical duties, setting up the back end of databases and everything. We are using EMTrack that's been provided by the state, and it has worked well for us in what we're currently doing. That information is uploaded daily to iCare via the HL7 export. We don't have to do anything, and things have been working fairly well. We've found some minor problems with it along the way, as we will. As you guys know, EMTrack was not designed for running a pod of any sort, but they made some changes, and we're able to use it, and it works well. I can just say it works well. The hiccups that we have found were minor, and we've been able to conquer those. We did host the good folks over at Anderson. So Eric brought a team out. Eric Brandenmeyer brought a team out just to see how we're doing things. By all means, we're not doing things perfectly, but he took the time out, and just as coalitions do and folks that share and collaborate, he came to see what we were doing and if some of that could help those folks out when they move to one of their vaccine sites that they're going to be starting. I'm not sure if they're started yet, but I'm going to pass it over to Eric to kind of give a little update as to what you guys are doing at Anderson with regard to vaccinations. Eric? Eric, if you are speaking, you're on mute. You're off mute now. Now you're back on. Now you're off. You might be double muted. Let's see if he dropped off. Let's see, we got a few more folks. We got 2 more folks just joined on. So Eric, while you get your mute situation worked out, I am gonna I'll bum rush, I guess. Brad Perry, if you wouldn't mind giving an update as what the folks over at St. E's are doing with regard to community vaccines.
Good morning, Phil. We are still running our clinics at this time. We basically do our community vaccine through the health department lists. So we obtain lists from the health department at, about 1,000 to 2,000 at a time. Upload those lists into our system, and then our system contacts all these people. We're just running in the same categories and so forth that the health department gives us. We are doing their second round of Moderna that the people who received at the fairgrounds. It was kind of perfect timing where we had Thursday and Friday where our second dose clinics, it just didn't time out where Thursday and Friday we had any. So we actually had no clinics planned, and it was going to look like our clinic staff was going to have 2 days off, and then the health department reached out for some assistance, and we actually ended up filling these Thursday and Friday of this week with their second dose Modernas, because you know, a lot of people do know or maybe don't know they started that test run with Moderna, but then quickly switched to Pfizer and have been Pfizer ever since. So we'll be doing 1,100 of their second dose Modernas Thursday and Friday. But we're chugging right along. We keep reviewing on a weekly basis, whether from a hospital standpoint we're going to continue on or start moving more towards med groups. That seems to be the gist of what people are doing, especially with our sister hospitals up in the Wisconsin area, is moving everything towards med groups. But right now, the pulse is that we're going to continue to run as we run, basically having clinic 5 days a week to the general public, but it is all by appointment only. Is there anything else?
Well, I would ask any major lessons learned that you have that you could share to this group.
Wow. I mean, we change every other week. We kind of change based upon lessons learned and so forth. And you know, the big thing with us and the volume and the numbers that we're dealing with is all upfront communication. I think is the big thing. We've really put a lot more emphasis over the last probably 4 weeks and a lot of effort, and a lot of manpower into reaching out to people who are enrolled for appointments and so forth. And then also trying to respond quicker to people who've got questions. But you know, I don't know, we could probably write a list of the lessons that we've learned over the whole period of time. And I mean, if anybody's got any questions about how we specifically do something at our clinic, I'd be more than happy to share.
Thank you so much, Brad. Okay, I'm gonna see if let's see, we'll try one more time with Eric. Eric, were you able to?
I hope so.
You got it.
All right, yay. Yeah, I think I sat on a button and it made anyway, that's what happens. No, I appreciate you guys having us over. We learned a lot. I'm very impressed by your setup there, and people were very nice to speak with us. We talked to some folks on the way out and on the way in, and you and Lee gave us a tour. We actually did start our offsite clinic at about halvesies this Monday, just trying to get the feet wet, going through the process, make sure, just like Brad said, you learn every day, just like you guys know. And hope to increase our numbers as we go forward. And we also did have a second round Moderna vaccination yesterday that we still had left over in-house. So we had 2 vaccination sites at the same time. That was fun. But that's over now. We got one more of those left that we're going to be doing in-house about mid-March. Hopefully, knock on wood, that'll be the last one we do in-house, and we'll be doing ours at our offsite clinic Monday through Friday, 10 hours a day. Yeah, they just like all of you, I'm sure, like Brad said, ours is by appointment only. And the numbers of people wanting the vaccine is very encouraging. So hopefully that'll continue. We have, I know from various other meetings, we've been working with Madison County Health Department to try and move forward with utilizing our EMS services to vaccinate the homebound. We feel we have everything in place. We're kind of waiting. We feel like the ball's in their court. About getting some folks identified and scheduled, and we have a number of EMS providers that are ready, willing, and able to go out and provide the vaccine to the homebound. So we hope that'll provide a decent service to the public as well. That's pretty much all I have.
Eric, can I ask a question real quick? Are you guys off-site? Are you using Moderna or Pfizer? Just one or the other? Or
We're using all Pfizer right now, Brad, because that's been good to us. We all know the pain in the ass challenge with it, with the handling efforts. But that has kind of been our key so far. Again, knock on wood, to continue to get vaccine. Because everybody wanted Moderna because it was easier. So who knows when Johnson & Johnson comes out? But no, right now we are doing exclusively Pfizer at our offsite. In-house, we did Moderna the last two. So.
Okay, well, I may get with you on that and how you're, if you've got a pharmacist on site that you're doing it, or if you're doing it at the hospital and sending it out, stuff like that. So.
Yeah, absolutely. We do currently, but like I said, it's early stages. I know we don't have intent of keeping that pharmacist out there always, but they will definitely have to be in touch, just because I mean, you guys understand the challenges with the Pfizer vaccine. So.
This is Ashley with Residential Hospice. Can I make a comment on the homebound patients? We have a lot of our patients that are asking how they can get the vaccine if they can't leave their home. And we have been directing them to their local health department. So I'm not sure if the health departments have been receiving those phone calls, but it's nice to know that some of the EMS is out there helping out, administering to those that can't get out of the house.
Eric, yes, and I was to say that is a great service, and I'm not sure how much, I don't know if Mike is on, how much we've had those discussions here, but Mike, have we had any additional discussions with regard to having, your folks at Abbott or MedStar or otherwise, Kim and Columbia going out to homebound folks?
We've not had any discussions with the health departments on that. The health departments really haven't in this area haven't really reached out to us greatly. I believe Monroe County Health Department had been talking with Ryan Weber and the guys at Monroe County EMS about doing that for the homebound folks, but I don't know that St. Clair County has looked at it or if it's even on their radar right now.
Okay, well, that's a good, I'm gonna take that as a note. Go ahead, Greg.
I was just going to say, so anybody who is doing that from an EMS perspective, meaning they're using EMS providers to do that, please keep me in the loop on all that, because we want to make sure we're following rules that protect them. If these are people who are just being trained separately, but if you're doing it as an EMS system and an EMS provider, just keep us in the loop, because we want to make sure that everybody is protected if they're doing it under the Act. So I've not received anything about any EMS providers going to homebound people, and we kind of need to keep that on the radar if that's occurring within the EMS system.
Perfect, and that makes sense. I know there's been some conversations, obviously, around some of our home health agencies and those folks going out. But yeah, first I've heard of EMS folks filling those type of roles. I think it's great effort. But I would agree with Greg. Let's just make sure that we're doing it in accordance with the EMS Act and et cetera, whatever other declarations that the governor's put out. So okay, but interesting nonetheless. Anyone else out there currently would like to discuss any of their, whether their challenges with regard to vaccine administration, successes, or things that may have flown under the radar that we're not highlighting from a hospital or EMS service that of note right now, or is there anyone who needs assistance that we could probably, shift some of the expertise that we do have or we've accumulated here in the region to you, so you can actually maybe start implementing some of those things. So I'm going to open the floor up for a moment to see if there's anyone out there with any other vaccine-related information and/or requests for information or support.
Hi, this is Tina, and I just have one question about the EM resource reporting. Sorry.
Okay. Go ahead, Tina.
So the question is, our local health department, Fayette County, is reaching out to us to help with vaccinations. So in the EM resource, when we upload our information every week, would we consider an extension of them and they would upload information to the state that we're another site for them, or do we enter in ourselves that information?
So Tina, would you be managing the clinic with your staff, personnel, and just your efforts as an independent site?
Yes.
Okay, that's independent. When I say independent site in support of the local health department. So yes, you would upload your information separately, and your process in how you're going to whichever web link or landing page you want those folks to go to. Now, some folks have it still going to a county location because they're collecting the information and then redistributing it. But other folks like ourselves here at Memorial here, we have our own landing page because of how we're using the whole EM track process. And we have a site where folks register. So that's kind of the only thing that you'd really be putting out there. Just here's where I want you to land, and we're managing that from that point on. So it would be indeed a separate site.
Thank you, Phil.
No problem. Any other folks? No? Okay. I'll give our two biggest lessons learned from vaccination. First things first, our EMS providers have been outstanding in the support that they provided us here at Memorial. So a big shout out and a big thanks to all of those folks. MedStar has been a godsend, but we've had other folks as well come out here. But we've had some really, 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 really big kudos come in from both the patients and the staff on our EMS providers, both their level of expertise and their professionalism. So we appreciate you guys. We really, in this region, kind of really led the way, both in Illinois and I would say in our STARS region of leveraging you guys as force multipliers to help us get vaccine out. So thank you so much for everything that you're doing there. And then the other thing I would say is our biggest, again, lesson learned is our pharmacy folks. Pharmacy has been a great add to our vaccine clinic. And some of you are probably saying, oh, why pharmacy? Why pharmacy? Why pharmacy? Obviously, they're managing the vaccines, but we're using our pharmacy techs and some of our pharmacists to not only just manage the vaccine allocations, et cetera, like that, but they're also doing all the drawing of the vials. So we've taken that out of the hands of the actual vaccinators, and that's where we're able to, if there's any place where we have time on our hands, it's at the vaccination station. So those who are vaccinating don't have to wait around that much trying to draw up and do a lot of documentation. They have very minimal documentation that they have to do, and they're not drawing vials, or drawing doses, which seems to take up the most time. All of that is pre-done, and it really increases our throughput. And if there's ever a time where we need to re-leverage manpower and put folks, refocus areas in registration, observation, or otherwise other logistical areas, we can actually pull from our vaccinators because they have the most time on their hands. So that's been one of our biggest lessons learned thus far. So, and we'll be talking about lessons learned here a little bit later here in our briefing. So we'll pause it there. And if anybody has any questions, concerns going through or going forward later, just shout them out. So let's go ahead and move forward. So we'll start off with our traditional. I'm sorry. Before we start off with our traditional agenda, there was one note, and I know Mr. McManus sent me something this morning because I didn't see it. It was a siren note yesterday or this morning about the storage of the Pfizer vaccine. So I'll just read it here quickly because I didn't get a chance to put it in the slides. Hopefully you guys got an opportunity to see it. I should be able to push this back out later this afternoon. But it said, as an update on February 25th, FDA announced it's allowing undiluted frozen vials of Pfizer COVID-19 vaccine to be transported and stored at conventional temperatures found in pharmaceutical freezers. And that's from -25 to -15 C or minus 13 Fahrenheit up to 5 degrees Fahrenheit for a period of 2 weeks. So that reflects an alternative, a change to the recommended storage of undiluted vials in an ultra low temperature freezer from which was traditionally the -80 to -60 degree range. And I know Eric kind of touched on, our challenges with managing Pfizer across the region. This gives us a little more flexibility with Pfizer than we previously had. I know we've had, when we do our regional redistributions, as the good folks up at the RSS site send them down here, and we bring our 5 counties in and redistribute those Pfizer vaccines out to Fayette, Randolph County, et cetera. This kind of gives us a little more flexibility in that. As we knew before, we previously were stuck with that 5-day window. Now this gives you more of gives you at least up to 2 weeks to be stored in that configuration versus the 5 days that we had before. So it's not the biggest extension, but that does allow us a little more flexibility. So hopefully everybody has a copy of that siren message, but I will send it out after this meeting as well. So Greg, I didn't know if you had any additional things with that, or if you saw that note.
No, you covered that correctly.
Good.
That is the what went out, and that's good news because it really helps with that ultra cold storage that was such a hindrance.
Yep. So great stuff. And Lee, correct me if I'm wrong, from what I understand, and Susan can probably, or excuse me, Helen could probably jump in on this one from the folks on the Missouri side, and Dale maybe can talk about this a little bit during his opportunity to speak here in the agenda. But I heard we had a lot of Johnson & Johnson arrive at some hospitals. So we'll hold that until, over on the Missouri side, we'll hold that until Dale gets his opportunity to speak. So we'll roll right over into Greg. Greg, IDPH updates?
Yeah, I don't have a lot because you covered a lot of it, but I will say that what I've been told at the state level is that the vaccine tsunami is coming. Not my words, their words. May not be this week, next week, but I think people have seen on the news that Merck is going to assist Johnson & Johnson, and the president has promised every adult American can be vaccinated by the end of May. So just be aware that all of the vaccine limitations we've had over the past few weeks, it looks like we're just a couple of weeks away from getting as much as we're going to be able to get and be able to vaccinate people. So that's good news. The other thing that I did want to bring up, just so everybody's aware, this is for situational awareness only. There's nothing going on. I mentioned it in the EMS quarterly meeting, is that Ebola is back on the radar in Africa. CDC has instituted some travel restrictions and travel screening, focusing travel from Guinea and Republic of the Congo to 6 airports again, just like what happened some time ago, for additional screening. And so just keep that on your radar that this is occurring again. And as I said in the EMS meeting, we remember when a few doctors and assistants from Africa came back and tested positive for Ebola. It really shook things up. So just kind of keep it on your radar. Nothing necessarily to do right now. Just know that that's out there again. You covered all of the statistics for the region, which are improving and looking good. So that's all I really have, unless anybody has any questions.
Any questions for Greg? No? Okay. Our public health departments, I'm not sure if Beth is on, if she was able to join. Okay. So without trying to, dig too much into what the local health departments are going through or receiving, as you guys know, that there is kind of a shift in how we're distributing the vaccines. There was a lot of direct ship. There's some direct ship still. We're still doing part of the redistribution, but a lot of that is still being fully managed by the local health departments. I did take a look at the next iteration. Greg talks about the tsunami of vaccine. I did take a look at the next 2 weeks iteration of distributions for all the counties. If you were to talk to one of your health department representative, if the Madison County folks talk to Michelle, or if I call up Sam or Mila here in St. Clair County, or maybe even I'll reach out to Terry, who's online from Bond County, and ask, do you think you're getting enough? The answer is going to be no for most of those folks. They don't believe that we're receiving enough vaccine. I will say for us, we are in a position where we may have to shift some of our vaccine clinics that we have next week. There are second dose vaccines to the right slightly, pending what we're going to receive. And I'm using air quotes, you can't see them, but on Thursday. So if there is a tsunami of vaccines, if you know anything about disasters, or at least when I used to live in Guam and have to prepare for tsunamis, you'll always recognize a tsunami. There's basically a pullback from the shores, and it looks like a drought's going on, and then the tsunami comes in. So we may be in that position right now where vaccine isn't as plentiful as it was 3 weeks ago. So there may be some horse trading and or bargaining going on, shifting of priorities going on. So just hang in there. That's all I can say. I know it's going to be tough for folks that are managing vaccine clinics. All I can say is just hang in there. If you're an organization and you haven't received your vaccine allocation, again, I just would say, just keep working with your local health departments. It's not in my position as the RHCC to kind of say who's getting what or what's going out there, although I do have some purview of that information. I would please direct you back to your local health departments to make sure that you're getting the most current information, because things still do kind of change daily. Okay. And when I heard yesterday that sounds like we're going to be receiving some Johnson & Johnson, I was like, oh, okay. When I say we, not the hospital specifically, but our region and what they're targeting to do with that, I thought it was fairly interesting. So more information on the way. So, all right, let's go ahead and move over. Stars, Dale.
So we're seeing, a lot of that same reduction overall in patients. Thankfully, everybody's doing a great job on that end. The statewide bed query through EM Resource, we were doing 8 a.m. bed queries. That has gone away effective this morning. So that announcement was sent out. So thank you for everybody for participating in that. I know it was mostly Missouri folks, but sometimes those Illinois folks did see it. And related to vaccine information, my information now is more than 30 minutes old, and we have taken the stance that any vaccine rollout information older than 10 minutes is likely to be inaccurate. So with that, news from today, I'm not going to share because it's likely inaccurate by the time this phone call ends. So yeah, Missouri, they're constantly changing rollout. So I have no idea. It's most of you probably are aware that they're opening up, the next layer of tiers, the March 15th, which provides some more people who are eligible. However, there's particularly a significant number of people who are currently eligible who still don't have vaccine, particularly in the urban areas, and there's just not enough vaccine to get there. So with that, we continue to struggle. I often look at Illinois and wish we had a system in place a lot like y'all's. Thank you for the encouragement that somebody's doing it better than we are. Other than that, I really don't have a whole lot. I mean, things are moving forward. That's about all we know.
Thank you, Dale. And you're right. Like you said, your 10-minute window is probably rapidly closing as far as your information change right now. So hopefully things will start to regulate out here soon, especially once we get Merrick and Johnson & Johnson working together and then getting out more of that single dose vaccine. Again, great information. Thank you for that, and hopefully we'll continue to see just an explosion or tsunami of vaccines coming here, and then we can just push it out to as many folks as we can. So, thanks so much. All right, Mike Remer.
Not much going on. We have started getting some requests already for later this year for assistance with different events. So we're actually putting together a training plan for an event in June for a training that's going on that they want Remer support for rehab. So we're doing an exercise on that to try to get some of our guys signed off on task books for different things. Other than that, we're just really looking to see where we can fit in and help out elsewhere.
Thanks for that. And as always, plug for Remer. They can always use support, just like any vaccine clinic. You don't have to be a vaccinator, so you don't have to be a paramedic or nurse, retired nurse, or anything like that. You can. They always need logistical support. So if you have a special skill, talent, feel free to jump out there and volunteer with Remer. John, were you about to say something?
Sir, I'm sorry. Hey, if Dale Chambers is still on from STARS, could I get him to give us a real quick update on the CCTA program? Because we've got a couple of things going on. And Dale, are you still with us, sir?
Yeah, no, I appreciate the call out there, John. So probably more related to the folks closer to the metro. The St. Louis Complex Coordinated Terrorist Attack Program is continuing. And yesterday we did have a really good exercise. It was a virtual exercise. Of course, we would have loved to have had it in person. But we had about 60 something participants. And that program has gone from when bang occurs and pre-bang to now this exercise yesterday was really about that sustained engagement, sustained operations, and fatality management, family reunification, and that sort of thing. And that is where we're moving forward with. We have a functional exercise coming up in April, and under the Urban Area Security Initiative grant, which includes some of our Illinois partners there, that program, the CCTA program, is going to continue to move forward and continue to develop in the direction of family reunification and things like that. And so, of course, we know that Missouri and state and Illinois laws are slightly different, so there are changes with that. Complexities, of course, always with the EM resource and patient tracking and family tracking and all of that. So as we continue to move forward with that, we just look forward to working with partners in Illinois to, expand that so that we create some documents and some guides that work for everybody, and recognizing that there are, individual communities that are different. Again, it's not a one size fits all. We've taken that approach since the beginning, and with everybody's participation that y'all guys have helped out with, it's been successful, and we continue to look forward to that. So hopefully, John, that covered what you're looking for.
John, I think you're muted if you did respond.
Yeah, yes, Dale.
Got it. Okay. Thank you, John, and thanks, Dale. All right. I don't think Sue is on, and I know Dana's not on. So we will, unless Sue is on, we will skip our mental health team update. I'll go through quick grant status update. So finally, we have our 2021 grant back and signed. So a lot of you probably received an email from me on Monday with regard to signing up for training. We'll talk about that here in a second. But I will just tell you this, that they're already working a no-cost extension through 2022 already. So I know a lot of folks that did apply. We've sent that information out. A lot of you have also begun to receive information from our BJC Grants Management Office on your sub-awardee paperwork. So that's starting. The ball has already started rolling there. So just a few dates coming up. So that grant training is mandatory for all sub-awardees. It's next Wednesday at 1300. That's what the invitation went out for. So please sign up, make sure that you attend that. It's normally about an hour, your opportunity to ask questions, just to go over all the federal guidance, to make sure everybody's clear on what is required. And again, it is mandatory for those who are receiving the grant. So please, please, please make sure that you are there and you are present so you can be accounted for your training. I do see, Dale, you have your hand up?
Yeah, and this may be a conversation offline, Phil, was this the HPP grant? And is that the 2021?
Correct. Yeah. So this was our FY 20 to 21 grant. It's been fairly delayed. I mean, a lot of it's been COVID related, but it was really pushed back and delayed, and it really hit our annual timeline for previous years. But yeah, we received it a couple of weeks ago, finalized, and signed, executed back from us, from our organization, back to IDPH. So we're going to start moving forward with that grant.
Yeah, Phil, it's Terry. I don't think the health department's got that invitation.
Okay, but yeah, I did send it out. It is on the Member Planet site as well. So I'll go back and check. And if I can, I'll forward it. I'll definitely will forward it out to Beth directly in Cruz for those to make sure that it's emailed out to the entire group.
Yeah, I'll tell you, if you could just send it to each individual health department, that would probably work better.
Yeah, well, at least all the health departments that are registered, and all the health departments are registered on, and I'm looking at all their emails right now. It went out, so maybe they need to check their spam. I'm not sure, because I'm looking at it right now. So I can see yours, I can see Vicky's, I can see a whole bunch.
Phil,
of folks.
if you want to send it to me, I can send it out too.
Sure.
And because I have a list of all of the health departments.
All right.
Yeah, thanks. That might work better.
Okay. Well, this is actually a slide over from. I was using this but I'll use it as a reminder. So we do have our annual plans review, even though this isn't the slide I wanted to use to talk about that. But we do have our annual plans review. We did talk about we took a vote on it I think it was our December meeting. It might have been September. No, I think it was our December meeting. Maybe it was September meeting. We decided to just move forward with the plans that we have as written. But we are going to be coming up on, let me just go to this next slide. I'm going to show you this, our regional COVID AAR, after actions and improvement plan. So what I'm going to ask is, with regard to plan reviews, is that we're going to have an upcoming AAR to talk about COVID response from a regional perspective on both the vaccination side of the house and just what we all went through going forward. And we want to kind of put that together as a full lessons learned from the region. So we'll probably have a lot of hospital related information in there, but the goal is to have that as a regional AAR. A lot of that, a lot of your hospital specific stuff that you're doing, within, a Fayette hospital, or you name the hospital, may not show up, but you'll probably want to start picking your brain and reviewing the plans. So when we do conduct this AAR, that we are able to, contribute to it. So I'm putting together some surveys now to help us go through that. But the goal is on in May, I think it's May the 12th, we'll be conducting like an AAR meeting, maybe like 2 hours plus potentially, so we can get all that information together, consolidate it, and file this away. While we will still be dealing with the pandemic, I think it's great to try to get as much of that written down and for posterity as possible, because we have not been able to exercise or do some of the other things. We've done plenty of communications exercise. You do EM resource all the time, even the unannounced EM resources, all of that type of stuff. We have plenty of radio checks. We're good on all those type of exercise fronts. We didn't get the chance to do our chem pack, so we were blessed with the pandemic. We worked through that, and sounds like Ebola's on the way. If that's Greg's choice, and/or rabbit fever, if he shall desire, that being the next thing that we gotta worry about. But COVID's provided us plenty of opportunity to exercise your internal command and control. With regard to HICS and ICS and all that type of stuff, as well as our regional efforts and coordination, whether it was supplies and equipment or general information sharing during this response. So put it on your calendar now. It will be out there on the site later this week, and we'll be sending out invitations to that. It may be a 2-part deal, but we'll have some surveys to fill out. And then we will also have some just coalition meetings via Microsoft Teams. So please keep that in mind. So you'll have to jump into those plans now, and we'll see where we're at later. So I'll open the floor for any and everyone who may have a concern or information that they want to share or questions.
Hey, Phil, this is Rick Wolf. I wanted to tell you the highway between here and Edwardsville at Anderson Hospital and back is clear. I showed up over there because I read the invitation as in person. So just wanted to let everybody know that Gateway is on. I haven't been on the whole time, though.
That route is clear. Thanks,
Right.
Rick. Yeah.
All right.
We're the good folks at BJC. I think we have to go through June before we're having any more real face-to-face meetings. So
Gotcha. Okay.
we are definitely not in the face-to-face era yet.
Okay.
Hopefully by June though, we may have a face-to-face meeting. That'd be awesome.
Sure. All right. Thank you.
Hey, just to add to that, Phil, Trauma decided that they'll be not face-to-face for our first Wednesday in June, just so you're aware.
Okay, got it. So that one is still going to be virtual. Okay. Yeah, and I'm pretty sure we're going through June the 30th, so we'll probably, when I say that as far as BJC, June 30th is where we're currently at. So we still have folks doing remote work and no face-to-face meetings, outside of the, 2 to 3 folks that get in the room and collaborate. So, all right, anyone else? Concerns, questions?
Phil, this is Molly in Greene County. I just want to let you know I was here too.
Yes, ma'am. Gotcha. Thank you so much. Okay, if we don't have anything, again, the regional AAR targeting 5/12 as the date. We'll probably just extend the current meeting that is on a Wednesday. We'll probably just extend that current meeting time that's there to accommodate. So please start to look out for those surveys. Probably won't send those out for another week, 2 weeks or so, but they'll be there to collect data from you to help put in into that AAR. As far as decon training resuming, it will be, like I said, post June, because we're stuck out to June 30th to do any face-to-face training. So please keep that in mind. But hopefully, maybe we can start back in July, August timeframe and get our. I know that's a skill that, it's a perishable skill. If you guys haven't been practicing inside, I'll be as transparent as possible. We haven't done a lot of practice here at Memorial, Belleville, or Shiloh. Because it's all been COVID. We've got plenty of PPE training and execution, but not a lot in our masks or in our PPE for decon. We haven't done a lot of that at all. So we're going to be a little rusty as well. Some of our instructors will be rusty as well. I'm going to say Scott's going to be rusty. I'll be rusty. Lee will be rusty. Eric's going to be rusty. So, but we'll get there. Trust me, we'll get there. If we don't have anything, I'll give you a last opportunity. Once, twice, thrice. Okay. Well, you guys have a great day, and we're going to end it here, and we will talk at you for the hospitals next week. So again, we had our meeting this morning. There will be no 1300 meeting today for the hospitals. So we will talk at you guys next week for the hospital. So take care. Have a great day.